Lovely stuff. Thank you. Yeah, if you want to go to the next slide, we'll kind of explain how this is gonna work. Um, so essentially, we've got a few questions that we want to pose, and then there's a few prompts that are on the screen as well, and just want to get a bit of a discussion going around from the scientific point of view and also the patient point of view of what we can see that's happening around the questions and what people's feelings are. So, what are the late effects of people for long-term like treatment for ALL, and so what do they look like? I think if I give some examples, so for me, infertility was one that I've faced recently, and bone density problems, and so those are some of the things I've had to navigate with not only my team that I dealt with my treatment with, but also secondary teams, so involving orthopedics and the women's hospital involved in my treatment. And so it's understanding what experiences you've had with the cancer patients that you've either treated or if you have been one in long-term effects following an ALL diagnosis. And feel free to pitch in for anybody.
I'd like to bring up something before we get all the way into long term, but just the fact that the treatment is long. It's a 2-year process, and that being compliant with maintenance has been a big issue here in the United States in our rural and low income families. And studies have shown there's a twofold increase in relapse if they're not compliant
So
with
that's with
maintenance.
just taking the medication and coming to follow-up
Correct.
appointments. Yeah.
Correct.
I mean, that definitely increases both long-term effects and also issues with long-term treatment. I think, like you said, it's 2 years for you in the States. I think for
Yeah.
me, it was 3.5 years as well. So then I imagine there's probably, well, I guess, is there evidence that it shows the longer that it goes on, the less people are receptive to continuing with the treatment?
I think that adherence is a really interesting and sometimes challenging topic. As Sharon quite rightly says, there's no question that if people don't take their maintenance regularly, there is an increased risk of relapse. And while, as Sharon quite rightly points out, if you're worried about where your next plate of food is going to come from or what's happening with your home or your family, often those issues will sometimes take precedence. So it does speak to the importance of having a good social worker working with anyone with ALL. Having said that, you can't pick someone who's going to be poorly adherent from the way they look. And in my experience, I think it's really important that we discuss adherence with everybody, not just somebody who you have a gut feeling might be poorly compliant with their medication. I think it's really important for patients to understand why they need to take their medication regularly, and points like the fact that relapse rate increases is certainly something to bring up. It's also worth talking to young people about some of the obstacles to taking their medication regularly. And, often what I'll say to people is you might want to keep your medication near your toothbrush. That way you'll remember every day when you're brushing your teeth to take that. Although, of course, that doesn't hold true for 3-year-olds or families who've got young children, where you don't want to be having the medication somewhere where somebody could easily access it. So I think that adherence is something which we need to talk about with all of our patients, that you very much need to tailor it to the individual as well.
I'm only going to put a little stop to this conversation just because it's actually the next slide that we're going to go on to, which are treatment and medical challenges. I probably should have said it a little bit earlier. But again, this is fantastic because that's also something that we're going to discuss next as well. And so just save those points and we'll revisit this quite quickly. But so just back onto what you're saying, the challenges for like long-term and late effects. Does anyone have any examples of where they have been exposed to a patient that's had longer complications to do with their body as a result of the treatment?
Joint issues have been a big issue with a lot of the children that were treated, from age 3 to age 7 that had by the time they were 15, having to have joint replacements,
I
which
think
is,
that's actually more of an issue for teenagers with
oh, okay.
ALL. It's not so much the younger children, but we know that for people treated in their teenage years, about 1 in 5 of them will develop avascular necrosis, usually of the hip or the knee. And looks like, James, that's something that you've experienced. So I'm sure
Bilateral
you'd be able
vascular
to,
necrosis. Yep.
yeah, so I'm sure you'd be able to talk about the real challenges that brings up, especially given that as doctors, we're often reluctant to joint replacements unless they're really, really needed because they don't always last forever. I'm interested, James, in hearing your experience of avascular necrosis.
It's been an interesting one. I think actually that, yeah, like you said, there's quite a few people that I know that went through ALL treatment, specifically with the corticosteroids, I believe, so dexamethasone, prednisolone, that have experienced vascular necrosis. And I think, yeah, the orthopedic surgeon team that I had were also reluctant to replace the joint too, which exposed me to many more years of pain and discomfort that I probably would have liked. But it is for a good reason. They do want to do it as late as possible. One, so that you're fully done growing, and so that you're not going to face issues around the point in which the joint is replaced. But then also there is that quality of life where however much I wanted to wait to have it replaced, there is also, it does massively impact your life in a good way having it done. I also think I was different to probably many people because I had a custom hip replacement. So the NHS team in the UK work with a Swedish company, Symbios, and so I was able to have a 3D printed hip, which is kind of cool. But I also have a valgus anatomy. So yeah, my hips at 140 versus the typical 120 degree angle. So I was a bit special, and I got special treatment. But of course, people having off the shelf hip replacements experience less adequate time before complications then set in when having a hip replacement as well. So yeah, I won't talk too much about it just because I could go on about it for hours. But yeah, it's been something that I know quite a lot of people have experienced, and I think I wasn't made aware of it at all going into the treatment and what the long-term side effects look like.
I think, James, that all of these late effects that you mentioned really speak to the fact that while on one hand we're doing really well with overall survival and relapse-free survival with ALL, it does come at a cost. And I think for many of our patients, they do experience chronic health conditions. And to me, this really brings home the importance of us developing newer therapies that are not just effective, but also have less toxicity as well. And I think that's the real challenge. And obviously, we don't want to take away elements that we know are highly effective, but at the same time, we need to somehow be able to pivot to more targeted therapies, which can produce just as good outcomes, but perhaps without some of those long-term side effects that we've been talking about. I think that's the real challenge.
No, fantastic point, Michael. Yeah, we definitely agree.
As we were saying, adherence is a really important part of treatment, especially in maintenance, because often by the time people get to maintenance, they've gone through the intensive phases of therapy. They're just starting to move back to school, back to work, all of those sorts of things. And often around those times, other life priorities certainly start to get in the way. It's really important, though, that people do keep taking their maintenance medication regularly, because we know that if you take less than, I think it's about 90% of your medication, it substantially does increase the risk of relapse, which is clearly something that nobody would want. So from my perspective, whenever I'm talking with patients in maintenance, we'll always discuss issues of adherence. I think it's really important that we don't just discuss this with patients who we suspect might be non-adherent, because sometimes the patient who presents as being the most compliant, the the best good patient may in fact be not taking their medication very often. So it's worth exploring these things in a non-judgmental way with all patients, trying to work out some of the barriers to taking their medication and trying to work out some enablers as well.
No, thank you, Michael. Any other of the like doctors in here that have had issues with, I guess, adherence to medication, like taking for any of their patients, or I guess as a patient, Pete, did you ever have days where you didn't want to take your medication and you missed some?
For me, I was quite happy to take them, but like I think inevitably, I don't know about you, James, but I was just in the situation where I was like, oh, have I taken it this evening? Or you just forget some days, and sometimes you do, you don't want to take a double dose. Yeah, so I think, because with me, I was taking a couple of tablets like every evening, and it was just a bit, it was hard to keep on top of, even though I was not intending or, intentionally trying to miss treatments or anything like that.
Mhm.
But I do
Um,
know as well, like from other speaking to other patients, that so many of them just wanted to give up. And where I was treated in Bristol, we actually did like a campaign, and we made a video to like try and convince ALL patients to continue to take their maintenance treatment. Because you don't want to undo all of the good you've done thus far, basically. So yeah, I know it is a problem.
Pete, for someone like you who did want to be continuing to take your medication, but sometimes couldn't remember whether you'd taken it or not, did you come up with any strategies that you found to be useful in that regard?
No, I mean I tried dosset boxes and that kind of thing, but really it's just when you're doing it for so long, it's more of a pain to put everything in a box and everything than anything else. But I mean, when I say the odd time I did forget, it was probably once a month, something like that. When I had a situation like that anyway, so it wasn't regularly enough that I was like, geez, I need to do something about this.
I actually had a bit of a problem with my medication. Again, on the basis of like not taking it, but having to have my dose reduced quite massively. As if I started off taking, I think anywhere between 70 to 100% of my actual dose for my body weight or height, that it always put me sub 1 neutrophils. So it always put me at risk of sepsis, and so at that point wasn't able to go to work, wasn't able to go out and do normal daily activities, and so my team had to lower my dosage of my mercaptopurine quite heavily. So that was something that was ongoing over the years of just managing what point my dosage could be at. And so it wasn't ever that I necessarily skipped taking my medication, but it was that I ended up having to reduce it quite heavily as time went on.
Yeah, that's a really good point. That reminded me actually, I had a similar experience. But mine was because of liver function. But nearly, I mean, I was being reviewed monthly, and pretty much every month the dosage would change as well. Which is, when you're trying to remember to take your medication and trying to remember what dosage you're on that week, it just presents that challenge
Yep.
as well.
Am I taking 1 pill, 2 pills, 1.5 pills, 3.5? Like, yeah, it becomes on top of everything, not only managing to take the pills, but also how much you're taking, at what frequency, and then also keeping on top of all of the appointments and managing those expectations is quite difficult as well. So emotional and psychological challenges. I think I always try not to talk too much because, again, I could do this for hours. But so have you had any experience with any patients that have needed any sort of therapy, or that have developed coping mechanisms, or that have come to you at different points and said how much they're struggling with doing long-term treatment or post-treatment as well in follow-ups, have found out that people have still been struggling?
I think this is a really common experience for people to have strong emotional reactions during their treatment. And sometimes it can occur at times that people don't necessarily expect. For instance, I find that often around end of treatment, at a time where people think they should be really happy, is a time where they're often feeling quite anxious, in that during treatment, as much as they wanted it to be over, they knew that they were at least receiving something which was helping keep their disease at bay. Whereas often I find that when patients get close to the end of treatment, their levels of anxiety start to creep up. And that's something which we often talk about and normalise and talk patients through. I think that's particularly the case as often at that time their visits to the hospital start to decrease in frequency. So the people who were there, cheering them along, so as to speak, they're not seeing them so often. And there's also the increased return to school, return to work. Often a lot of that happens in maintenance. And some of the focus of treatment discussions goes on to things like late effects as well. So I think often around end of treatment is a time where patients can feel more worried. And I find that's a time where we need to often step up some of the supports for patients. But I'd be really interested to hear your experience, James and Pete, having been there. What were the times that you found to be particularly difficult?
The end of treatment completely. Honest, all of the points that you've made, they perfectly resonate with me, probably with Pete as well. I had a very close group of friends who all had cancer and who all shared the same sentiment, that when treatment finished, it almost felt like, all right, cool, pack your bag, off you go. And it was distressing, to say the least, to be in a situation where I didn't have that immediate access to care. I didn't have that immediate phone number I could ring whenever I was feeling worried about maybe I had a random lump in my armpit at one point, and I knew that I was never fearful because I could just ring the hematology team and be in the next day or like within 7 days and be seen. I don't know if you're aware of how the NHS has gone in the UK recently, but that kind of access to care was incredible compared to what we'd have now. And so, yeah, I think the fear and anxiety definitely crept in. And then not only just following my treatment, but I think also I was recently discharged completely from the service, so no 6-month or yearly checkups now. So woohoo in one aspect. At the same time, I cried my eyes up because it was that element of complete fear and not abandonment, but it was something that had been a part of my life for so long and something I'd gotten used to was just all of a sudden gone. And so, yeah, it was quite a daunting experience, but liberating at the same time.
I've also seen this with parents of children that have been diagnosed with leukemia. I had one that it was the treatment stopped and she came in to see me, never wanted any support during the treatment. But when the treatment ended, she came in, she said, I don't know what's wrong with me. I can't stop crying. I said, did you ever cry at all during any of this when your daughter was diagnosed? And she said, no. I said, that's because you were focused on what to do, what was next. I said, now it's safe enough that you can actually feel the full emotional impact of what happened to your family. And I said, I encouraged her to cry for the next 2 weeks. And if she didn't stop, then to come back and we needed to discuss. But normalizing her feelings, I think, went a really long way in helping her.
Yeah. Right. Well, yeah, we'll move on to the next one. I think very good points. Yeah, I completely agree with everything everyone has said so far. And so the last one, yeah, what are the social and lifestyle changes? So do people still do sports? Do they still go out and see their friends? I think very different to Ask Children, because for me, I was 19. So the later end of, well, the later end of my like school and sixth form and like education. So yeah, have you seen many changes with people seeing friends or whether they've picked up or left certain hobbies?
I see this with the young adults more so than the younger children, especially if they had to go through a stem cell transplant. The impact on their life has been enormous. They haven't been able to continue in school or college. their ability to start having interpersonal relationship has been impacted. So it's a young adult, late teens that I've seen this mostly with.
Yeah. Pete, what did you find with your lifestyle when you were going through and following treatment?
Yeah, mine completely changed. A really complete overhaul in terms of, I was similar to you, so I was 18, so completely isolated socially, and lost a lot of the friend groups and connections that I had. I was also, I appreciate this is different depending on where you're treated, but here in the UK, a lot of the time, you're directed to a principal treatment centre. So I was staying away from home for 9 months while I had my intensive phase of treatment, which meant that really I, had lost a lot of the my daily life, a family and friends and support network who would have had around me. That kind of all dwindled away because I was taken away. But also, it's at that age as well. I mean, I know it's been touched on how like for adolescence it's a difficult time, but especially with just like all my friends going to uni and stuff, it was really like it's really developmental age to be going through something so alienating, and it did completely changed my day life really.
I think it's quite a transitory period in our lives, isn't it? Between the ages of 18 and 25, let alone slightly younger. And I think it was I was very much the same as Pete. I was being treated an hour and a half, 2 hours away from home. So whenever I was in for the first quite a few months, it was a lot of effort for people to come and see me. So it just meant that I was very detached. And then seeing everyone, it was the years that everyone was going off to university. So seeing everyone going away, living their best lives, experiencing being away from home for the first time, and having those incredible memories and experiences. And I was in a hospital bed. So it's a big change and a strange thing to get used to. And I don't think there is something you do get used to. You're kind of just waiting for the end and then waiting to get back to normality, right?
We know that during the teenage years, the rate of neurocognitive development is second only to infancy in terms of the changes that are going on. And from a psychosocial perspective, there's so many changes that are happening. And I think it really behoves the treating teams to be thinking about this and addressing this right from day one. So many times we've come across young people who go through their treatment and think that at the end of treatment, they'll just go back to what they were doing beforehand and take off where they left off. And then they discover that actually there's been so many changes that have happened in their friendship groups, in what people are doing, what's happening. And that will frequently result in young people feeling even more alienated than what they were before. So I think this is where it's so important to have, I guess in the UK, the TYA teams at the Teenage Cancer Trust units, or in Australia, Youth Cancer Services, who are looking at those psychosocial aspects right from day one. I think it's really important that we do encourage young people to maintain contact with their friends. And even if you have to move to a different town, make sure that you're keeping in contact via social networking, texting, whichever social network platform of choice you're using, so that you stay linked in with your friends. I think it's also important that we encourage people when they're feeling good, that they do exercise, that they do keep active, because we know that that's not only good for you physically, but it's also good for your head as well. It also speaks to the importance of us thinking about schooling, keeping people linked in with their education, talking to young people about their plans for university or vocation, so that when they do get to the end of treatment, there's not this sudden shock. So my view is that this needs to be considered right throughout treatment.
Amazing points.